syndrome. It is a collection of signs associated with glomerular disorders. It is a acute in onset and it consists of microscopic hematuria, mild proteinuria, mild hypertension, mild edema, and oliguria. The urine will be smoky in appearance and there will be RBC gas in the urine, which is a classical feature of nephritic syndrome. And the proteins that are excreted into the urine are around less than 3 grams in 24 hours. And this is called as non-selective proteinuria. So non-selective proteinuria is seen in nephritic syndrome. There will be edema because of sodium and water retention. To the differences between nephritic syndrome and nephrotic syndrome. In both nephritic syndrome and nephrotic syndrome, there will be proteinuria and edema. But the proteinuria is around 1 to 2 grams per day in nephritic syndrome and it is more than 3.5 grams per day in nephrotic syndrome. And in nephrotic syndrome, it is selective proteinuria, low molecular weight proteins. Whereas in nephritic syndrome, it is mild proteinuria and it is a non-selective proteinuria. Hematuria is characteristic of nephritic syndrome represented by RBC gas and hypoalbuminemia less than 3 grams per deciliter with reversal of albumin globulin ratio. Only fibrinogen levels are increased in the blood. All the other protein levels are decreased in nephrotic syndrome. Coming to the hypertension, hypertension is characteristic of nephritic syndrome, but in few advanced cases of nephrotic syndrome also hypertension is present. Azotemia and oliguria are characteristic of nephritic syndrome, and hyperlipidemia and lipiduria are characteristic of nephrotic syndrome. If in the exam, if 3 marks question is given, very short answer questions, then you have to write at least these 4 differences between the nephritic syndrome and nephrotic syndrome. Differences between nephritic syndrome and nephrotic syndrome are given for a 6 marks question, that is very short answer question in the university exams. You can write these 10 differences. 1. Proteinuria, mild proteinuria less than 3 grams in a 24 hours is seen in nephritic syndrome, and heavy proteinuria more than 3.5 grams per in 24 hours is seen in nephrotic syndrome. Hypoalbuminemia, lipiduria, hypercoagulability are characteristic features of nephrotic syndrome seen in nephrotic syndrome and they are absent in nephritic syndrome. Edema is mild in the loose tissues because of sodium and water retention in nephritic syndrome. Marked edema, both generalized and peripheral edema is seen in nephrotic syndrome and it is because of the decreased colloid osmotic pressure because of hypoalbuminemia. Microscopic hematuria is present in nephritic syndrome and it is absent in nephrotic syndrome. Hypertension is present in nephritic syndrome and it is seen in advanced stages in nephrotic syndrome. Oliguria is present in nephritic syndrome and it is seen in advanced stages in nephrotic syndrome. They may ask you for MCQs. What is the most common cause of nephrotic syndrome in adults? Then it is membranous glomerulonephritis. And if it is asked like most common cause of nephrotic syndrome in children, then the answer is minimal change disease or lipoid nephrosis. If the question is given like what is the most common cause for nephritic syndrome, then the answer will be rapidly progressive glomerulonephritis or RPGN. The cause of edema in nephrotic syndrome is hypoalbuminemia or decreased colloid osmotic pressure, and the cause for edema in nephritic syndrome is sodium and water retention. This can be asked for MCQs and in Viva they can ask you these 2 questions. What are all the glomerulonephritis that are being coming under the nephrotic syndrome and that are coming under the nephritic syndrome will be in nephrotic syndrome, as I said in the previous videos, It is primary glomerulonephritis because of the MCD, minimal change disease, or membranous glomerulonephritis, or membranoproliferative glomerulonephritis, or focal segmental glomerulosclerosis, and focal and diffuse glomeruloproliferative glomerulonephritis, and IgA nephropathy, or systemic diseases like diabetes mellitus, amyloidosis, systemic lupus erythematosus, or systemic infections like HBV, HCV, HIV infections, and bacterial endocarditis, syphilis, leprosy, or some falciparum infections and filariasis may end up in nephrotic syndrome. And all the hypersensitivity reactions and malignancies and toxemia of pregnancy, renal vein thrombosis, constructive pericarditis, and hereditary diseases like Alport syndrome, Fabry disease, nail patella syndrome will show nephrotic syndrome. Coming to the nephritic syndrome, it can be because of cause may be primary glomerulonephritis or any systemic disease. Under the primary glomerulonephritis, it can be acute glomerulonephritis, rapidly progressive glomerulonephritis, membranoproliferative glomerulonephritis, focal and diffuse proliferative glomerulonephritis, IgA nephropathy. 5 conditions. In the acute glomerulonephritis, it can be post-streptococcal or non-streptococcal. In the systemic diseases, it is SLE, polyarteritis nodosa, Wegener's granulomatosis, Hinosh-Schönlein purpura, and cryoglobulinemia. With this picture, you can be able to appreciate that the primary glomerulonephritis like membranoproliferative glomerulonephritis, focal and diffuse proliferative glomerulonephritis, IgA nephritis are present in both nephritic syndrome and nephrotic syndrome. That's why in this sometimes hematuria is seen. And in the systemic disease, SLE may present with nephritic syndrome or nephrotic syndrome.